Hello there, welcome to Let's Just Talk. I'm your host, Hami. Today, we are joined by Amany Quaddour, a visiting scholar at Brown University. Amany also serves as the Regional Director of Syria Relief and Development, a humanitarian NGO. Amany is also a Doctor of Public Health candidate at Johns Hopkins Bloomberg School of Public Health. She's been working on the ground in Syria and Turkey since the earthquakes on February 6th and is here to give us updates from the ground. Amany, welcome to Let's Just Talk.
Thanks.
Of course. Amany, can you begin by telling us how you began your work in Turkey and Syria after the recent earthquakes?
Yeah, I've been working on the Syria humanitarian response for many years now. A big hub of this humanitarian response, specifically for the northern part of the country in Syria, is from Turkey, Gaziantep, Turkey in specific, where the earthquake actually hit on February 6th. This response includes, UN agencies, NGOs, donors. A lot of sort of this epicenter of humanitarian response has operated from this. And then on February 6th, when the earthquake hit, it sort of reversed the tables in terms of humanitarians themselves being affected by this natural disaster.
Can you say a little more about how humanitarians themselves were affected by the disaster?
Yeah, of course. For us, we have a team, let's say, talking about our team on the ground in Syria, we have over almost 2,000 staff on the ground, for example, humanitarians. So doctors, nurses, social workers, midwives, case managers for gender-based violence, for example, and then a lot of our support team that are actually based in Turkey. That has been sort of a response that's operated now since the start of the Syria conflict. So almost 12 years, since 2011, this response has been active. In the aftermath of the earthquake, though, that affected certain parts of southeast Turkey, so Kahramanmaraş, Gaziantep, Turkey, Antakya, Hatay, one of the oldest cities, all of these areas were deeply affected by these 7-point-something magnitude earthquakes that hit within less than a 12-hour period, sort of back-to-back in different parts of this region. Gaziantep, one of the areas that I live in, part of the year. And so in the aftermath of the earthquake, you had, thousands upon thousands of people affected where their homes have either collapsed. We've unfortunately had staff that have been killed, including in Syria and in Turkey. And, I have to give condolences not only to the staff that we've lost and their families, but the families of staff members. One of my staff members lost 40 people from her family in southeast Turkey. Another one of our colleagues is still missing with his wife and daughter. So we're praying for them, and we're hoping that there may be some kind of a miracle, but just the loss of life that resulted in the aftermath of the earthquake. And then to add to that, you have humanitarians who many of them themselves are Syrian refugees. They've endured multiple rounds of displacement in different parts of the country inside of Syria to ultimately, seek refuge in Turkey. So you have this compounded vulnerability now over time where humanitarians themselves, many who have worked on the Syria response, are affected. And what we found is the system is not equipped yet to serve humanitarians that have been affected by natural disaster. At the same time, they're responsible to serve affected communities on the ground. And that's something that a deep sort of glaring gap in the sector that's now emerged in the aftermath of the earthquake.
Right. So I'm so sorry for your loss and your coworkers' loss as well. So basically what you're presenting to us is that the ones who were there to help in the first place now need help, but the systems in place are not equipped to deal with this kind of dilemma that has been caused by this disaster that has occurred. Can you say a little bit more about the impact of the earthquake on the communities themselves, along with your peers? You started talking about it a little bit. Can you elaborate some more on that?
Yeah. Let me first just touch on sort of the complexity of this, because oftentimes, you have many other contexts. You have Haiti, you have Nepal, you have other areas that are very, earthquake prone. Turkey is one of those countries. It lies on 3 different fault lines. So it wasn't really a surprise that an earthquake has it, but just in terms of the severity and the impact and this culmination of, southeast Turkey being an area that is quite close to Syria, where there's been conflict for many years. So this compounded nature of conflict meets natural disaster has been extremely complex in terms of response. And what we found are, so many communities, for example, in northwest Syria that have been affected, as I said, previously, in terms of multiple rounds of displacement, aerial attacks to hospitals, schools, marketplaces, very poor infrastructure. Hospitals and clinics are deeply and desperately in need of rehabilitation. Poor housing. You have millions of people in this part of the country who live in tents. So they're already in precarious sort of living situations. And then you have this earthquake hit. Prior to the earthquake, we were dealing with a cholera epidemic. for example. Prior to that, we had COVID. So, you know, every winter there's a series of flooding due to climate shocks. So we have this series sort of crisis within a crisis within a crisis that's sort of, you know, then led to a lot of this vulnerability or compounded vulnerability, I'll say. And then on the Turkish side, as I said before, you also have a huge part of this population, obviously. You know, our thoughts and prayers are with, you know, our sort of the Turkish people who've been affected by this disaster in the southeast. And in addition to that, you have Syrian refugees who are some of the most deeply vulnerable as well. You know, the impact has been obviously immediately in the aftermath is people losing their entire homes. Some people, because the earthquake took place, I think 4:15, 4:17 in the morning, people didn't even wake up. There are some people who just died simply in their sleep with a building that might have collapsed within a matter of seconds. You know, part of the larger picture is just in terms of even just access to basic services in the immediate aftermath after your home has been destroyed. You know, you need the basics. You need shelter, you need food, you need water, and you need obviously sort of sanitation infrastructure. People need to use the bathroom. You need to make sure there isn't another cholera epidemic because you have 40 families that are in a collective center. And, you know, these are all sort of related to basic service delivery, but obviously as a public health practitioner, we're also thinking about some of the other health implications that will result. As I said, cholera and other infectious diseases due to overcrowded living situations. And then something that's often neglected, especially in the aftermath of the earthquake, beyond making sure people are physically safe and protected, is the mental health implications. Is sort of following this trauma, how are we helping people sort of cope and navigate in the aftermath of the earthquake with losing
40 family members at once?
Yeah, exactly. Losing family members, knowing, you know, some of the colleagues, you know, their lives, you know, their children, their spouses, their parents, just reconciling all of this loss at a time when you are also expected to respond to the needs of individuals that are even more vulnerable and have been, you know, slid further into poverty or may have lost their entire life savings. And for people that have, you know, been sort of survived many years of conflict, you know, chemical weapons, as I said, attacks, all of these elements sort of have said, you know, it doesn't even compare for a second to what we dealt with the earthquake, because it's something that's just completely out of our hands.
Right.
It's not man-made.
And unexpected.
Sort of a natural, unexpected, and certainly for people on the Turkish side who may have, you know, lived through the conflict, but may now be, you know, 5 or 6 degrees of separation. They've been, you know, 4 or 5 years out of this part of the country, have sort of been distant from immediate conflict, and so have found some semblance of at least stability in the last few years. All of that was dismantled immediately after the earthquake, and it felt for many starting over, all over again.
And so you mentioned conflict a lot. You mentioned aerial attacks and so on. Can you talk about the challenges and obstacles you face in delivering services and aid in areas that have been stricken by conflict for a long time? So now you have a compounding effect of conflict and natural disasters. How do you effectively provide aid in these areas, and what are some of the barriers that you see preventing you from, you know, effectively doing this?
Yeah, I mean, in the aftermath of the earthquake, what we saw was on the Turkish side, you know, a lot of our colleagues needed several days to sort of gather their wits and collect themselves. Many had to seek shelter in other cities because Turkey was so close to this, you know, this epicenter. On the Syria side, you know, many of our staff within 24 hours were up and running again. And to me, as cliche as I find the word resilience sometimes, I truly think it was part of their resilience, because for someone who resides in an area within a conflict zone, there is a different type of resilience, because they've been used to constant attacks and displacement, and as I said, epidemics and overcrowded living situations and all of the factors that sort of brew to the top in a conflict zone. I think our team, you know, a lot of the barriers, some of them are physical barriers, you know, the you know, Turkey sort of obviously bordering Syria, a lot of that had to do with access and delivery, as you're not able to reach, you know, there was 5 days where international response was not able to reach, you know, Syria. So for 5 days, you had humanitarian responders, frontline responders inside of the country in Syria, able to respond to the needs of populations. And this is why, you know, for many who believe in sort of, you know, strengthening the capacity or supporting local communities, they need to be equipped to respond to whether it's conflict or disaster, because they're the ones left behind.
Right. And what are some of the political situations that prevented people from having access?
I mean, Northwest Syria is a very particular sort of complex dynamic where, access for specifically humanitarian assistance from Turkey into Syria relies on a cross-border resolution that's voted on every year by the UN Security Council. So as long as there's a vote to allow international humanitarian assistance into the country, you're able to deliver that aid.
So even during natural disasters and crises, we still need to wait on the UN and other bodies?
Yes. So there was an existing UN Security Council resolution that permitted aid, but what I think people did not anticipate is, you have roads completely blocked. You have roads destroyed by the earthquake. So aid is actually not able to get in. So what you have to rely on are the aid workers inside of the country, are supplies, medical equipment, food stocks that exist inside of the country. And this is why for those of us in the aid sector, preparedness and planning is a vital part of it. You need to make sure to what we call pre-position sort of some of these supplies as close to communities as possible, because one border closure does not allow you to access this part of the population for over 5 days. 5 days during a search and rescue effort inside of a country that's been affected by an earthquake means life and death. Right. I mean, recovery is, once people have already passed, is 72 hours. So those are very critical moments. On the Turkish side, this is where there's such a sensitivity in terms of search and rescue efforts. And the complexity of conflict also means you might have seen dozens of search and rescue teams come from all different parts of the globe to support, obviously the Turkish population that were desperately in need of search and rescue efforts. On the Syria side, it was a very complicated issue. There were no search and rescue efforts that came from sort of the international side to the population in Northwest Syria. We might have seen it in other parts of the country, but this is all part of the unfortunate sort of politicization of natural disasters and conflict, and what is often called now earthquake diplomacy. Yeah.
We're going to move on a little bit to if you have any particular, during your time working on the ground, can you share any particular stories or experiences that have stuck with you, and what have you learned from them?
I mean, there's been a lot of experiences that have stuck with me. I would say just because it's in my rear view window, is obviously the experience after the earthquake. I think just as someone who's worked in the humanitarian sector for many years now, I think to me what the humanitarian community has faced, and obviously other, affected communities, has been unprecedented. And I think something that's emerged is just how far we have to go still to protect aid workers, to ensure that they're able to serve the communities that are most vulnerable in these situations. I also, some of the experiences are, I think vicarious trauma or secondary trauma is a very real thing. Oftentimes it's called compassion fatigue. For those in the aid sector that have been working many years to serve others, I still see a lot of gaps and inequities, to be fair, in terms of how we also support humanitarians. I think there are a lot of other moments that stick with me, just obviously in terms of our teams, but also the communities we serve. I've been, as much as I try to be just a passionate champion for women and girls in particular. And something that stuck with me is just the plight of women and girls in conflict. And just seeing everything they've faced, and just, for us, for my team, and many other actors, we respond, for example, to sexual and gender-based violence. Providing sexual reproductive health services is critical even in times of conflict. So for me, something that always deeply touches me, and an area where I see we still need to do better, is obviously providing some of these vital services that are life-saving in the context of or natural disaster that often fall by the wayside when we think about other immediate provisions like shelter, food, and health. So those are some things that have stuck with me. And then just, as I said before, I'm not always the biggest fan of resilience because it's oftentimes overused, but really just the resilience of our teams is just in terms of the constant challenges they've faced, and then just their ability to adapt and cope and still prioritize serving others, even when their own families, some buried their own families and then went back to the hospital to treat those that were injured or that might have survived in the aftermath of the earthquake. So those are stories, that stay with me. And then also just put, such a responsibility, not only on immediate response, but just in terms of also as a sector, as
Right.
in humanitarian sector, or sort of in response to whether it's disaster or conflict, where are there some blind spots? Why did this happen? If another earthquake happened tomorrow, it's likely that the same thing will happen because there are still major gaps in the humanitarian sector that is not fully equipped with a massive humanitarian community
Right.
being affected by a natural disaster
Right.
or being sort of in need of humanitarian assistance themselves.
And so I don't want to overlook this. For those of us in areas that are not experiencing these disasters or areas that are not experiencing conflict, what can you tell us about the plight of women and children in these areas for us to get a better picture from someone who's working on the ground
Yeah,
about what their plight is?
globally and in most, disaster settings, conflict settings, 80% are women and children. We have to structure a response primarily for women and children. So we often see, gaps in terms of gender-sensitive programming. We see specific needs of children. In contexts like Syria, there's child labor. There's an economic crisis that's happening not only in Syria, but in the surrounding countries themselves, in the region. We saw this obviously in the aftermath of COVID as well. We saw donor funding dwindling because obviously countries started turning inward in terms of responding to their own domestic needs. So you have all of these complicated factors, in terms of not just Northwest Syria, but other, countries that are affected by conflict. You oftentimes see sort of norms become more entrenched. You see, a rise in child marriage because families, need to have some type of coping mechanism to ensure their security. And that's not, the security of their children, whether it's for us, oftentimes in Syria, we see young girls getting married off, and in 12, 13, 14. So you see a lot of these very harmful sort of coping mechanisms emerge that ultimately affect not only their lives but just in terms of sort of their future prospects.
Right.
Those are some of the issues that oftentimes are overlooked when we think about sort of large scale humanitarian response for a population where these very sort of tailored needs don't all and we just don't have that luxury.
And so we're nearing toward the end. What are some of your insights in terms of long-term recovery and rebuilding some of the affected areas? Especially this is going to be difficult for areas that are in conflict.
Yeah.
So what is your take on that? And then we'll start wrapping up. Okay,
recovery is a bit more complicated. I'm trying to think of how to answer this. The humanitarian sector is a bit limited in terms of, this is where there is a barrier in terms of development activities. Reconstruction oftentimes is tasked under development, which is a completely different sector. And this is why we have the nexus, which is, sort of trying to bridge the humanitarian development and oftentimes peace, sort of, in many countries that are fragile, recurring climate shocks, violence, insecurity, where you have to bridge the gap between sort of humanitarian, which is oftentimes 6 months. So when we think about Syria, it hasn't been 6 months, but we're still sort of investing in humanitarian activities and completely neglecting, for example, early recovery. As I said before, the health infrastructure, housing, without rehabilitation or recovery activities for some of these, at least from a physical infrastructure standpoint, people are still going to remain in those sort of vulnerable conditions. So in some parts of Turkey, Turkey was affected by, as I said, it's on, multiple fault lines, but, in 1999, there was a massive earthquake that hit Turkey, another part of Turkey. And following that, there was supposed to be sort of reinforcement of codes and making sure buildings were up to code to be more earthquake proof. This earthquake has demonstrated not all buildings were up to code. And certain areas that had extremely fragile housing is where you've seen the most loss of life. And a lot of that relates to just governance and accountability and transparency in making sure that people are able to access safe housing. And this was what we've seen in the aftermath. And it's even more concerning when you see areas that are heavily and densely populated with refugees being the most vulnerable. And so this is all, again, when we think about the way forward, especially with urban planning and sort of reinforcing areas that are prone to natural disaster, this is part of what we have to think about as well.
And so lastly, I'm going to combine these two last questions. What are the roles of, or should be the role of international organizations and governments in responding to humanitarian crises, such as the recent earthquakes? And finally, what advice do you have for individuals wanting to get involved in this or wanting to know how to support?
Let me take it step by step. So just in terms of international organizations, so you're talking maybe about UN agencies or international NGOs, humanitarian response is obviously, it's a collective. You've got local NGOs on the ground, you've got international NGOs that are involved, UN agencies, you have donors. And when I say donors, I don't just mean private donors, I mean institutional donors. So the very large governments that are providing funds for response. So a lot of this is, one is mobilization. In the aftermath of the earthquake, every second, every minute, every hour, every day means more lives lost. So one is being able to rapidly mobilize and save lives, I think, is just the essence, sort of is a humanitarian imperative. I mean, that's the sort of number one mandate, is to save lives. I think oftentimes it gets a little bit complicated because it's also a very bureaucratic sort of, when you add in terms of the complexities, not only of natural disaster, but sort of marrying that with conflict. We've obviously seen this is a completely unprecedented situation where sort of conflict, everyone can agree. What we saw was everyone agrees those affected by a natural disaster need support. That has not always been the case for conflict-affected communities. And we sort of need to draw sort of better boundaries in terms of mobilizing response for these communities that are in vulnerable situations, these civilian populations that are essentially affected by natural disaster and sort of long-term protracted conflict. Conflicts in many, parts of the globe, and there are many examples, obviously, whether it's Yemen, Afghanistan, Ukraine, years of conflict. For refugees, most refugees reside outside of their, country that they fled from for over 10 years. So just in terms of thinking of long-term solutions, I think that's something we need to. Humanitarian response is very short, acute, and immediate. And seeing some of these protracted conflicts and sort of the impact now of natural disaster means we have to think about long-term planning and sustainable solutions, because funding is finite. Exactly. You can't just keep pouring money into something if you don't address some of the root causes. In terms of related to sort of people trying to get involved, so one, we'll tackle it in terms of people who are very passionate about sort of providing support. I'm not a very big fan of disaster tourists. For those who aren't equipped and trained professionals of search and rescue efforts, so they're not, paramedics or EMTs, they're not seasoned humanitarians, they don't have a technical expertise, just to show up as a disaster tourist, just to see what, the commotion is oftentimes more detrimental to seasoned, to seasoned humanitarians and to those responding to a crisis. In other words, stay home if you're going to be detrimental and get in the way. Don't use up that plane ticket that should be, dedicated to someone who's coming to respond to the crisis and has experience or is from the region, understands the cultural nuances. That's all part of sort of the accountability and responsibility, oftentimes called AAP, accountability to affected populations, is knowing the context, knowing the cultural nuances. The second thing I would say is for those who are really passionate and want to support beyond if they're not necessarily, technical experts of some kind, is really looking at providing more support to local organizations and first responders on the ground. And again, this is not to discredit, as I said, sort of all of the structures that exist within the humanitarian response, but local responders are the ones at the front lines of service delivery. And they're often the ones exposed to the most risk, and they oftentimes don't have sort of equitable sharing of risk between what's happening on the ground and all of the other actors upstream. So something we have to do, and this is often called duty of care, where we sort of protect our aid workers and protect first responders. There's an equity even in terms of how we protect sort of international responders versus national or local responders. So we have to sort of balance that scale a little bit better, I think, in the aftermath, not only of this earthquake, but just generally in the humanitarian sector. And then maybe for those who are thinking about entering the humanitarian sector, I think that would be, obviously it's an incredibly rewarding, choice, but it also comes with its risks, and it comes with really making sure, especially now with sort of this new wave or new generation, that you are, we've talked about equity a lot today, you are familiar with sort of ensuring, there is an equity lens applied to response, so that you're not just imposing response on affected communities rather than having them be design hand in hand with you or sort of take priority with that. Obviously applying, like I've said, sort of a gendered lens, an equitable lens, And then just a lot of very sort of common sense in terms of, as I said, affected communities need to be part of the solutions, and it has to be driven by them. That's the only way sort of to have sustainability in this sector. And again, that ties into sort of the decolonizing narrative, where you have to involve local communities. Otherwise, you're just, as soon as, internationals have to leave, you have entire programs and interventions collapse.
Amany, thank you so much for being with us, this stuff.
Thanks for having me.
It's been great, and we look forward to continuing this work with you.
Yeah.